Let's start with the federal announcement. First off, kind of summarize, what are your feelings on the nearly $20 billion?
I don't have the details yet, and my understanding is that the premiers have been negotiating like up until this minute at the 12th hour on what the details will look like. So I have to be a little careful because I don't know what the details are, but certainly this is a conversation that we have been having with the federal and provincial government since the very beginning. We have never before asked for operating assistance. We manage our own budgets. But this year are extraordinary times. So the City of Calgary, which never runs a deficit, is looking at a deficit between $200 and $400 million at the end of this year. And we can't pay that back with increased property taxes. We can't pay it back by cutting the services people need as the economy is starting to rebound. So this issue of operating funding is really important. So I'm very happy that the federal government and provincial governments have come to a conclusion on operating funding. Now, I don't know how much of that will be for Calgary. I don't know what restrictions will be placed on it. I know some of it will be just for transit, which is the most important piece. Some of it may be for other operating deficit issues. But I'm very pleased that we've sort of broken the logjam on this, and I really look forward to working to make sure that the program meets the needs of Calgarians.
The Prime Minister also mentioned homelessness as part of it. Curious, what are your thoughts on what are the next steps for Calgary and homelessness after the convention center shelter closed and found some additional housing?
Thanks very much. So there's a real opportunity here on homelessness. Let me back up a little bit. We had this huge number announced today, $19 billion, which is this massive number, but it's got a lot of different things in it. So it really is a matter of figuring out what the buckets are supposed to be and what amounts are for those buckets. So, I don't want homelessness to be competing with PPE for healthcare workers, for example. But I do think that we learned a lot during this pandemic, and we learned a lot about how the system that we have allowed, it's not natural, we have allowed to grow up here around emergency shelters, around how we help people who are living with homelessness, is undignified and frankly dangerous. And so I'm hopeful that one of the things coming out of this pandemic will be thinking about housing in a whole new way. And listen, I am not above saying that here in Calgary, given our vacancy rates, given the reasonable prices of some of our rents, we actually have the opportunity here with a pretty big cash infusion to do something extraordinary, which is to end functional homelessness in Calgary. We have an opportunity here that other cities may not have given their own housing markets. Let's take advantage of that. Let's make ourselves a deal that when we come out of COVID, nobody who was displaced by COVID will ever go back to the shelter. That every single person will be housed in market housing with rent supplements, and affordable housing, in supportive housing, or in treatment beds. If we can get our heads around that fact, then we have the opportunity with a relatively small amount of money to completely change how the most vulnerable people in our society are treated coming out of COVID, and I think that's a wonderful thing for us to think about how to do.
I understand that there's still details that you don't know yet, but do you know how much money you
No idea.
Do you know when you'll
So no, I know none of these things. I wish I did. This is the constant problem of confederation, which is that the federal government deals with the province deals with the cities, and you end up in this big mishmash. So I'll give you an example, which is we've been talking since the beginning of COVID about how building and construction and infrastructure will be an important part of coming out. So the federal and provincial governments have been talking about stimulus funding for infrastructure, but here we are, middle of July, almost August, and not a single dollar has flowed yet. Meaning we may well lose this construction season without any of this additional funding happening. And this is a perpetual problem in the Canadian Federation. But it's irritating now because the problem is so extreme, we need to move quickly. So in terms of the operating funding, look, we don't close our books until the end of December. I probably don't need a check until then, but we're going into budgeting. So we need to know what's available, so we need to know what services we may have to cut next year if we can't cover the deficit this year. And we need to know that soon.
And what about the fact that there's a big chunk of money that's supposed to go to childcare? Do you think that's going to help more women go back to the workforce?
There's a few things that are going to be critical around helping the economy start up again in a time of COVID. Because remember, COVID's still here. And the two things that are much on my mind are childcare, ensuring that we have physically distanced childcare, allowing parents to be able to get back into the workforce, and transit. And one of the reasons I'm such a proponent of wearing masks on transit is because we need people to feel more comfortable taking transit so that they feel more comfortable going back to work. And so these are the sorts of things we need to focus on. And I'm happy that the federal government's announcement today talked about both transit and childcare.
And what about COVID cases? So I think there's watches for Calgary Elbow and Calgary Center. Yeah. What's your reaction to that? And the fact that the cases are increasing?
So for a couple weeks now, I have been suggesting that for me, a mental trigger is when we get back into the triple digits in new cases per day. And we did that today. So while our numbers remain low, thankfully, while Albertans and Calgarians did a great job of flattening the curve, we're trending in the wrong direction. We know there will be a second wave. We know this. And our work on flattening the curve to push that second wave as far out as possible to where there might be a treatment, to where there might be a cure, is very critical. Or to where there might be a vaccine, I should say, is very critical. And so when we start seeing these numbers tick in the wrong direction, earlier this week our R number, which is a measure of how many people can be infected by one infected person, went to levels that we haven't seen since April. So this is really very dangerous. And I need to remind all citizens that the power to change this is in your hands. Physical distance matters. 6 feet, 2 meters, the length of a full-grown llama, you have to stay that far apart. Dr. Hinshaw had a good analogy today. Think of when you're outside in the winter and you can see your breath. Those are the droplets. Those are the viruses. So think about how far the steam from your breath goes. You have to stay at least that far apart. So that really is all about the 2 meters. We have to go back to what we were saying at the very beginning. Wash your hands, don't touch your face, cough into your sleeve, carry the hand sanitizer around. I've got some in my pocket right now. And just sanitize your hands all the time. Wash them when you have access to a sink, 20 seconds at a time. These basic hygiene things are important and they make a difference. And the third one is, when you are indoors and you cannot be guaranteed that you are going to be 2 meters away from everybody at all times, you've got to cover your mouth and nose. So on transit, in crowded stores, in indoor places, mask wearing is essential. And I want to remind people that it's not wear a mask or the economy. It's wear a mask to save the economy. Wear a mask to ensure public health. Because if people don't do it, if they don't do those three things, physical distancing, good hygiene, wearing a mask, when the second wave comes, we'll have to shut down again. None of us want that.
We know your feeling on mandatory masking might come in Calgary, but the Premier is quite adamantly against it. Do you want to see some leadership from the province on that, or is it up to cities?
The Premier and I have talked about this endlessly. He is actually very pro-mask, but he is nervous, as one would be, about a provincial mandate, because there are parts of the province where the infection rate and the transmission rate are very low. And so he's asked the municipalities to figure this out. And so in my case, look, we're going to have a discussion at Council on Monday. There will be a range of options. I believe that on transit, these are people we're responsible for. They are our customers. We are providing them that service on our property. And there are good economic reasons that we need ridership to go up on transit. So I believe we should do it on transit sooner rather than later. I also believe that in preparation for a second wave that we hope will never come, we should set up our trigger points for where we are going to require masking in stores, in other indoor spaces, and so on. Obviously, we're not going to require it in restaurants. You cannot eat with a mask on. But there are various things we can do to get to that level. And so, we're willing to take the bull by the horns on this and have that conversation. But it is unbelievably important. And today we saw 2 parts of the city that had very low rates of infection go onto the watch list. Look, those 2 parts, I'm not going to make any bones about it. Those 2 parts of the city include a lot of strips with a lot of restaurants, a lot of bars, a lot of places where young people are hanging out. And anyone who goes down 17th Avenue Southwest or Marda Loop sees very poor masking, very poor adherence to physical distancing. what did you think was going to happen?
On that note, playoffs are coming. You just mentioned bars. What are your concerns about people going to bars to watch playoffs?
No red mile this year. All of us want the Flames to go very deep into the playoffs. I hope that they do. There is no red mile. This is the year that you should be enjoying the playoffs at home. And if you want to have a bit of a party, put the TV in the backyard, have a party outdoors 6 feet apart. Don't congregate, don't walk down the street without physical distancing in mind. If you want to support local businesses, consider takeout or consider supporting local businesses that have very good physical distancing in place in their businesses. These things matter, but public health is more important. There cannot be any congregating like there have been in previous years with the Flames in the playoffs. There just can't.
I'll have the mic a little
Yeah, go ahead,
closer
Terry.
to you. I just want to know, I wasn't paying attention to everything because I was thinking about the microphone. With the childcare question, is there any is there any details that you can even go on of what that need is in Calgary for this?
Well, I can only be anecdotal about this, right? As we switch to people working from home or perhaps people not working, certainly the challenge was folks who had people to take care of at home. And for me, working from home was actually very easy. As long as the internet worked well, it was easy for me to do that. In fact, I chaired a committee meeting this week from home. That's not so easy if you've got kids. If you've got young children that are preschool aged, or if you have young school age children. So for a lot of parents, they're actually being asked to choose a very horrible choice. You can have a kid or you can have a job. And for our economy to work, we need people to be able to participate in the workforce. And that means that people are going to be able to have access to childcare for preschool children, also for school-age children, if the schools don't open on a normal schedule in September. But that childcare has to be physically distanced, it has to be safe, it has to be cleaned, and obviously we have to figure out how to pay for all of that. So I'm really happy that we are very late, but at least now starting the conversation on childcare.
What would you like to see on the front for Calgary in that area?
It's not really my specialty, and I don't have kids. What I want to make sure is that not only are the kids safe, that they're not bringing anything home to their parents and grandparents, but that we're also focused on the parents' ability to work and the parents' mental health, quite frankly, and the kids' mental health. So we got to have a solution that is holistic in nature, that really looks at the physical and public health and keeping everyone safe, that looks at everyone's mental wellness, and that also looks at the ability of people to get back to work.